So today we are going to discuss about the IV cannulas, intravenous cannulas. So as we can see, we have arranged the IV cannulas from the smallest to the largest. So this is mainly these three are mainly used for the pediatric patients, and these three mainly for the adult patients. So as we can see, this is the 26 gauge cannula, which is purple in color, and the flow of from this cannula is the slowest, that is it is around 10 ml per minute, which is mainly used in neonates. Second is this yellow cannula, which is 24 gauge cannula, and the flow from this cannula is around 18 ml per minute, and this is also used mainly in the neonates or the infant patients. This is 22 gauge cannula, and it is used for the older child, and the flow from this cannula is around 31 ml per minute. So as we can see that mostly the flows are doubling from one size to other size, so it's easy to remember from that. Now about these three cannula, these are mainly used in case of adults. So this is 20 gauge cannula, which is pink cannula, and the flow from this cannula is around 55 ml per minute. Next is 18 gauge cannula, and the flow from this cannula is around 85 ml per minute. And the next is grey cannula, which is 16 gauge cannula, and the flow from this cannula is around 180 ml per minute. So the flow is highest from the grey cannula and the slowest from the purple cannula. Grey cannula, and as we don't have now, but the cannula for 14 gauge cannula is also available in various centers, which is 14 gauge cannula. 14 gauge cannula and 16 gauge cannulas are mostly used where you need where you are expecting blood loss to be more, or you need more transfusion, more rapid transfusion to the patient. So we use grey cannula or the orange cannula, that is 16 gauge and 14 gauge. For the rest of the time, we prefer these two for the adult patient and these three for the pediatric patients. So that's all for today's videos. In next video, we will learn how to put a IV cannula. Thank you.